training, no business experience. So a lot of us are figuring it out as we go. And that was my dad's passion, who really had a lot of great...
Which one is your dad?
Oh, sorry, my dad is the handsome guy on the left. Yeah. And that is the CEO of the Northwest Agricultural Business Center, which was his the last work he did before he retired. So I just was excited to get this invitation to join you here today because co-ops have been so much of my growing up. So the Aging Life Care Association, care managers, we don't have protected titles like registered nurses do, or somebody who might have, an MSW. People come into care management with all kinds of different educational and professional backgrounds. So our professional association really kind of provides that umbrella for us. It's what helps unite us in our vision and the mission of the work that we do. There's about 2,000 of us nationally that are part of the Aging Life Care Association. How many of you are familiar with Aging Life Care as a distinct profession? That's not uncommon. A lot of people aren't. I think that's something our professional association, like yours, is working hard to get the word out on what we do and why it's important to know about us. But it's a very holistic practice. We work primarily with older adults, but many of us work with people across the lifespan. And we look at, things related to health and medical concerns. We're looking at housing, we're looking at legal stuff, we're looking at financial things, at family dynamics. The knowledge base for aging life care managers is very broad. So when we talk about people who are coming into the work from a lot of different backgrounds, there's a lot of professional and educational and experiential diversity within our organization. A little bit more about what we are. We talked about, not all of us are credentialed. At our highest kind of level of membership, we encourage everyone to pursue credentialing. It is a differentiator, I think, for almost any profession. But there's a ladder. There's a way to come up to that level. But that's, I think, also part of what we want to portray to the public. And that's, again, why I think this Aging Life Care piece about the Professional Association is important, because it is a differentiator for consumers. These are our 8 knowledge bases. So we're not attorneys, but we need to know enough about some of those legal concerns for when to send someone to an attorney, right? So we need to have some basic understanding of what is a power of attorney. How might that be different than the guardianship or conservatorship? If someone needs a power of attorney, what kind of attorney would we send them to? So the knowledge base is very broad, though it's, we're not always in depth in every, all 8 of those areas, especially people coming in. You often come into the work very strong in some areas, and then you build your knowledge base in those other areas. My association likes to describe us as the quarterbacks of care. So, this idea of how do we build teams for our clients. Home care and caregiving is usually the backbone of almost every care system. But who else do they need? Do they need physical therapy? Do they need behavioral health services? Do they need an attorney? Do we need to get them connected with entitlement programs? So again, we're kind of the quarterback. I'm not a football person. I think of myself as like the symphony conductor. There you go. To be that advisor and be that team builder. For our Aging Life Care Association, this kind of gives you an idea of the hierarchy, so there's different levels of membership that you have based on your experience, based on your background, based on whether you decide to credential or not. And at the highest level, which I'm not there yet, but I'm working toward my fellowship, has a lot to do with how you mentor other aging life care professionals and your leadership within the organization. So for most folks who, you're here to talk about home care and talk about your cooperatives, and I want to talk to you a few slides down about how I envision this might work for some of you. But where people come into the professional association needs to be a nurse, an LPN, an RN, or someone who has an associate's level education as a minimum to come in to join the professional association. There are lots of aging life care management practices and programs that have a member. Not everyone who is delivering the services is necessarily a member. So I want to talk about that so that we can visualize how to overcome some of those barriers if the people the team you might be building to look at these services don't necessarily meet this criteria right off the bat. And then this talks about levels of memberships. The aginglifecare.org is our website, so a lot of this information is available there. For the credentialing part, there are 4 different national credentialing exams that qualify for that advanced professional status. I have the CMC, it's the one I took some years ago. And then this talks again, I'm going to get through some of these quickly because I really want to talk about your individual businesses and what this looks like more at a micro level for you. How people engage us when someone might need an aging life care manager. And some of this you will probably recognize in the work that you do. Do family members always agree on what should be happening? Do you have to offer support and guidance and advice to the families that you're working with to kind of get on the same page about the individual care that you're working with? Do they need more information about what other services might be appropriate for them beyond the scope of home care? Are you working with somebody who's vulnerable, where they have needs that you just keep seeing falling through the cracks and they need that additional advocacy, and maybe you're providing it, but you can't capture that in terms of revenue because it's outside of what's actually happening with the home care. This is just a little bit of an aside. I think some of the benefits of getting to know the aging life care managers, whether or not you decide to incorporate this as a service that you're offering, but I can speak for myself and my colleagues. We need relationships with people who provide home care services. We're seeing a lot of rising costs. We're seeing the quality go down. We're seeing a lot of difficulty with getting the kind of communication and collaboration with our partners who are in the home care space. We're looking for partners. All of us are looking for partners. And one of the primary functions of aging life care managers is to build a team. 100% of us make referrals to home care companies. So if you don't already know who the aging life care managers are in your area, go to aginglifecare.org, do a zip code search, and reach out to these folks. They do want to meet you. And so you know how to reach out and build a relationship. There's the website. But I've got some handouts if you need one that's got this information as well. So now to the stuff that I think everybody really wants to talk about. Why even consider this? Why might this be a good idea? I actually started my practice because I was a director of nursing at a franchise, a home care company. And I was in the homes doing those assessments in Virginia. They require, the state requires that a registered nurse go out and do all initial assessments before home care services are delivered. So I was doing that and having a really hard time staying in my lane because I'm going off and I'm checking off the ADLs and I'm seeing all of these other things around me that need to be addressed. We need different durable medical equipment. We need a house call provider, a PCP that will come into the home because it's too hard to get this person out. We might need a psychiatrist that specializes in geriatrics because we have somebody who's having some really challenging behaviors that we're not able to fully resolve with, some tweaks to our care approaches. I'm seeing all of these things and I'm just very limited by what I can do. So I had one family that I was working with that had a live-in caregiver. It was a couple. So a live-in caregiver. But then the husband needed lots of pillow fluffing and stuff at night. He was very crabby at night. The caregiver couldn't get any sleep. So we put in overnight awake care. So the live-in caregiver could sleep. We had overnight awake care. Then the wife, her dementia was advancing. So one day when we had him in the shower, she walked out the front door. So then they wanted another caregiver there during the day to have eyes on her. So right now, they're spending tens of thousands of dollars in a month in home care, which is not bad. Like every home care company wants to make that kind of money, but it wasn't ethical because they weren't really understanding there was another way. And so I worked with the family, and my home care company was kind enough to allow me to give them some coaching on what are some different alternatives. Because we really needed to get the wife into memory care. It wasn't safe to have her at home anymore with going out in the middle of the night. And so we ended up getting them moved, and when when home care services ended, it was a natural ending for home care service. They said, we don't need home care anymore, but we need you. How much do you charge? And I thought, how much do I charge? And that's how I started my practice. So it came out of a need that was already there, this need that all of you are seeing with these families every day. The aging life care, that care management piece, I think it's a huge opportunity to differentiate from your competitors because we've got, at least, and I can really speak mostly some for Washington State. I have a practice there too. It's smaller. That's where I'm from. My practice here in Northern Virginia is much larger. But I think that we have a lot of heavy franchise action, and it's pretty cookie cutter. I call it the caregiver factories, where they give they give their caregivers, text them a name and address and send them out, and they're not invested. They're exhausted because they're literally working 24 hours a day because there's that much work out there. They're not really all that loyal to their company, and they're not really all that loyal to my client most of the time. So it's just the having something that sets you out from what else is out there. Because consumers, especially this generation that we're taking care of, a lot of them just still take what they're given, and they assume this is the way that it's supposed to be, and they don't challenge it. I see it in the healthcare and the medical side, and definitely in the service side. So I think it's a huge opportunity for differentiation. And I think that it's also a way to kind of get out there, get in front of more potential clients, because you will have some people who will need home care and also need care management. But I'm telling you, business is so good for care managers right now. You will have care management clients that you will get pre-home care need, and then they are already in your pipeline. And there are models for this across the country. A lot of them started as aging life care management practices who were dissatisfied with the options, the home care options in their area, and decided to start doing home care so they could have some control over it. So there are a lot of practices that offer both. But again, we see this need growing. We know, everybody reads the statistics, it's only going to grow more. And we have this national shortage of caregivers. I mean, it's, the need is there now. So models for service delivery, I'm fairly familiar with a lot of the models out there nationally from working, at that national level with my professional association. And because probably like you, we're all a bunch of small businesses, we all do it a little bit differently. But in general, hourly care management is pretty standard to provide those services on an hourly basis. Some practices might charge in 15-minute increments. My practice bills in tenths of an hour. We bill in 6-minute increments because it allows us to track our time very tightly, and I'm sensitive to not overcharging clients for things that can be handled quickly or simply. But that hourly care management, pretty much every practice offers that. Some people offer, and I do too, standalone assessments. So maybe there's someone who either doesn't think they need or don't want ongoing care management services, but you can go in and do a standalone comprehensive assessment to really look at what those current needs are and provide a roadmap for the family. And home care is always a part of that assessment in terms of identifying a need, but you also might identify a need for, you can look at a home safety piece. Do they need to bring somebody in to get grab bars installed? Do they need to have their legal paperwork looked at? Again, these aren't things that you necessarily need to do, but what you can do is identify the need and then get them connected with your partners in the community who can do this for them. And, again, with or without home care services, remote services, I have something on my website that allows people to book a 1-hour consultation with me. And it connects to my Google Calendar. It takes them right to PayPal. They have to prepay for it. And people do this without ever having a conversation with me. In the middle of the night, I wake up and I see them booked, and your insight, your expertise, your experience has tremendous value. People will pay for that expertise and that guidance to talk with you about what is going on with their parent and how to get them the help they need. And so those are ones that sometimes I have people will convert to coming over and being care management clients, but it also allows me to help people who maybe can't afford ongoing care management, but really need to address what to do when their parent should not be driving or concerned about safety, or how do I know if this memory loss is age-related or if dementia is happening. Again, you're not a neurologist, but you know who is. You know how to get them connected with maybe support groups. Maybe it's the Alzheimer's Association. Maybe it's day programming. All of these resources that you're aware of in your community that support people with dementia. That's what I do in those 1-hour conversations. And sometimes they come back to me for ongoing services, or sometimes I've just given family you can get a lot done in an hour. And I've never had a single one where somebody didn't feel like they did not get their money's worth out of that hour. They're really, really popular. The consultations, again, some people look at that a little bit differently than an assessment that might be in person or it might be remote. So I wanted to save the bulk of our time to answer your questions, maybe ask you some more, about what you're seeing in your practices and talk about some creative ways to look at something like this as a service line for you. So let's start with your questions.
Thank you. Our co-op is talking about incorporating new services, and it's services we already provide as caregivers. And so I'm curious as to how other co-ops are managing the fee structure, especially since we've been, not that we've been giving it away for free, but we have been charging the same hourly rate for smoothie making as we charge for dealing with the VA, which is a lot more complicated and requires more skill.
Yep.
And so how do you make that leap with clients? How do people make that leap, charging more for those services?
Yeah. So, you know, I can tell you how, and again, I don't have a home care company attached to my practice, but I do have colleagues who do. So the way that they define home care is really looking at ADLs and some of those IADLs. That's home care. If people need, you know, again, the advocacy piece with entitlement services, the referral piece, the consultation piece, that's care management.
I think we've been really able to identify the difference between the ADLs and the care management. I think the piece that we're at right now is in an 8-hour shift, you might do some of both. And I guess the point we're at right now is transitioning from caregiving to caregiving and care management. And it's just a kind of a tricky kind of leap. Because like on a team, you know, are we going to differentiate who on that team? Like Tuesday, you do care management duties, and obviously the caregiver doing those will be paid a lot more. And also I think this is something that I think everyone can relate to. We spend a lot of time with our clients in the office, not only during intake and starting services, but ongoing. You know, some client families are very high need.
Yes.
And where do we start charging? That list that you gave, you said something about football, we do all of that.
Yeah. Yep.
And for the most part, we're not charging for any of
No.
it. So how do we make that leap? I think we've been talking about this for how long? Since the first home care conference here in Virginia. And so we've got all of our documentation. I've got the care management description. I've got the service agreement. I just don't know how to make that leap. I don't know how it looks.
So, you know, I mean, I can relate a little bit in terms of when I got going, when I started, and where I am now 7 years into my practice. My practice looks very different than when I started. So I think it might be creating the structure to bring new clients into. It may be more difficult to transition existing clients that are used to all of these wonderful things that you're doing and not charging them for. You know, that might be tough to say, okay, now this is going to look really different. So I think it's kind of defining where those boundaries are. As a care manager, we believe it all starts with an assessment and a care plan. So I think that, you know, if working on access to entitlement programs is part of what they need, then maybe there's somebody in the office that is managing that care management care plan. It could be somebody in the home that is working on it. So for example, we do a lot of medical care coordination, taking people to appointments. which I know you already do, but that's, we might use home care company that's already in the home to go to that appointment, but maybe I'm calling in when the doctor's in the room. And I'm preparing that formal report to send the family. And maybe I'm following up on scheduling the next appointment or arranging with the caregiver for when they need to go do lab work. That's care coordination. So I think some of it is defining those tasks, what bucket they fall into. And just like your care plans, and every state has different laws and regulations, but almost everybody's got to have some kind of a care plan, right? You have to define what services that you're providing. So I think that things that are, and I'm not going to say there's not ever going to be some gray area. There is. I mean, just this week I had a care manager take someone for a swallow study, and the client wanted to stop for lunch on the way back. Am I going to charge my rate to take that guy to lunch? Like, that's highway robbery, So I let that one go. I called it relationship building, I ate that hour. You're always going to have some gray area, but I think that a well-defined personal care plan and care management care plan can make it clear or clearer about which bucket it falls into.
I was wondering about, just like you have your experience, like long-time experience, and if we want to build it into our co-op, but maybe you don't have, like, you've done some of it, but not necessarily like you really want to build out a quality service to do the assessment and the care plan. Like, what is the training? What is like, is there already that out there that like someone could be trained into it, or is it just like research that's done in your local area? Or?
Well, so a variety of things. I mean, I guess my first question would be, how many of you are in states that require that you have a nurse engaged at some point in the home care process? Yeah.
What state is it?
New York.
Yeah.
New York.
So, I'm all, for small business, you want to use the resources you got first, right? So if you have a nurse, if you have someone that has a social work background, somebody with, some kind of healthcare administration, any of that kind of background, that might be a place to start. Many of us, when we're starting, we kind of work with people kind of PRN, right, as needed to get things started, and as you grow, those things grow. In terms of building your knowledge base, the Aging Life Care Association, that graphic that I showed you of the knowledge base for aging life care managers, really, we look at this and we see what's in the community. So if we're looking at housing, you probably are already aware of what the housing alternatives are if people aren't able to age in place in their homes. So you want to build relationships with those folks. There are lots of online things. I'm just a big fan of you get out there and you meet the people in your community. You should have relationships with an estate attorney, someone who is also in small business, who is as interested in your referrals as he is in sending those back and forth, because there's so many intersections in what you do and what they do. And so this is building your network of people to ask questions to. I have a couple of attorneys. I emailed one this morning when I had something I just wasn't sure about. Is this somebody you can help? Do I need an elder law attorney for this, or do you think an estate, attorney can handle this? So you build your network and you build your knowledge base. And I heard so much talk about training. We're always training because things are changing, and you can't possibly know it all. So you just, you commit to that education and learning, and There are things I would do very differently. People I took care of 5 years ago, if I knew what I, what I know now, then we all learn and grow, right? You can't possibly know it all getting started. So I wouldn't let that be a barrier. And you probably know more than you think you do.
I have a question over here. Over here on the left, right. I'm just curious, if you could say a little bit more about your business, both in terms of like, if it's just you, if you have different types of staff that you have do different roles and what those are, and even like how many clients you can serve at a time. I think part of what, at least I'm thinking about Aki, is around just like, we're trying to build a network of cooperatives in California and, thinking about someone like you being part of that team and, what's the scale where like, okay, you need another one of you, or it's too small and it's, not enough clients that you're like, oh, I couldn't serve that as a full-time worker. So just share a little bit more about how you run your business.
Sure. So I now have a group practice. We're now a team of 8. I do have an office manager, and I have it is part of that 8, I have a non-clinical person who I use kind of, again, that companion care pocket, the errand thing. There is such a huge need for that right now. If you're not already doing that, find yourself some aging life care managers. They need your help with that. Those people who can get people to their haircuts and things. People who don't need personal care, who don't need help getting to the toilet, who don't need a bath. But I'm getting off track. So I have a non-clinical person. I have a student. I have an MSW student who does a little bit of clinical and a little bit of non-clinical. And then I have the rest of my team are all care managers like me. So I consider my care managers now, I'm blessed to have grown to the point where I can offer salaried positions for my care managers. And we started offering health insurance this year, which I am very proud of. Thank you. We want to take care of our people. But for us, the level of care management we do, about 20 care management clients is a full-time caseload for a care manager. And those are people that, it's in my contract with my clients that we have to see people in person once a month. The care manager does. Because I believe that if we're not putting eyes on people, it's difficult to really bring that value. We need to see what's changed. We need to see how they're navigating their home. We need to see how the spouse is coping, in order to really shine the light down that path and help people anticipate what's coming and get out ahead of it. So some people we see once a month, some people we see twice a week. We have people who, maybe the adult children live out of state or they travel a lot for work and they want eyes on their loved one in a skilled nursing facility or in an assisted living. They don't need 4 hours, 6 hours, 8 hours of bedside care in that setting, but they want someone who can be an advocate. They can make sure that there's not dirty linens piled up in their shower floor and that their clothes are clean and that they're not losing weight. And, somebody who can help problem solve when things aren't quite as they need to be. I suspect that's something that any of you could do. So, I charge $175 an hour, and I bill in 6-minute increments. I came up with that figure by hiring somebody to secret shop my competitors and just make calls and make inquiries and figure out, and I'm right in the middle. I would say that, our largest aging life care practice, care management practice in Northern Virginia charges $225 an hour. Yes?
Do you charge more, like if someone that day is like, I need someone to go check on my mom today, do you charge more for that or the same rate, or is it different based on urgency? Like, you have an urgency?
So so I have an accelerated after hours rate. So for things on weekends, holidays, or after business hours, I do charge more. You know, it is a concierge service. I hate that word, but it really is what it is. And so, you know, for a care management client, if there really is that urgent of a need where a care manager needs to go see them the same day, you know, we would probably just try to make it happen for them. If people come to us in crisis, which happens, you know, my mom's in the emergency room, or it's usually, my mom's being discharged tomorrow, what do we do? And the case managers in the hospitals, because of Medicare regulations, can't say, go to that rehab, not that rehab. But I can, you know, because I'm in all of those buildings, and I know where you want to go and where you don't want to go. So I can guide the family on that. So we do get people in crisis, but I usually, those are opportunities. If you have someone with that kind of an urgent need, and you can meet that need, chances are you're going to have ongoing business there, because you just solved the most pressing problem.
Can I just ask another question?
Yes.
I'm just trying to get some clarity in my mind. So thank you. How would you suggest a home care agency, you know, like we pick up the phone and someone says, I need care. And we go out, we do safety checks, we do, you know, home assessments, we create care plans, we create care teams. At what point do you think we should start charging? Because I don't think any of us are, right? We're just going out there for free. How do you think we can integrate this revenue stream for doing this great service that, you know, I'm not able to make that leap in my head.
Yeah. So, you know, I mean, again, I'm not as familiar with the model. Are you, in general, priced higher than your franchise competitors hourly? Okay.
Just for clarity, Tiffy, you're talking about like when people are approaching our cooperatives for like private duty care,
Yeah.
right? So somebody's reaching out to us to get the personal care services in place for their loved one family member.
Yeah.
Right? This is a different set of services that you're speaking about.
No, they do this.
Well, but I think there's a lot of overlap, because I think that, you know, you have chosen to be part of a cooperative, which means that you prioritize the quality of the care you are delivering. You are worker owners, you are not a caregiver factory, right? So you're already probably doing a much better job than what we're seeing in some of the franchise models out there. So I think, again, it comes back to, for new clients coming in, defining it. I also know it's tricky, because when you're getting started, you want your rates to be competitive because you need the clients, right? People need the paychecks. You're trying to build that part of your business. But I think that, you know, when you see some of these franchises, like what they're charging for the service that people are getting, it's pretty shockingly bad that, you know, and maybe for someone like you, if you're having a hard time differentiating the buckets, maybe it's an enhanced service. Maybe what you're delivering is home care plus, and maybe that comes at a higher hourly rate because of the broader services that you're offering. Because I can tell you, some of these big franchise names are not doing home assessments, you know.
Hey, thanks. I'm Nora, and I kind of want to build off that question a little bit that could be raised. I know that most of the home care co-ops that I work with, one of the ways that they get clients in is offering a free assessment. You know, and often that free assessment, you know, while they're saying, I would like home care, they're actually asking all of the questions that you're bringing up. You know, they're kind of sussing out, do I need this? what do they say, should I get bars, like rap bars, all of that stuff. And so for me, kind of to Kippy's question, you know, if that's how you're currently coaxing people in, you know, to make that sale, you know, and get that client, you know, and then you're alternately offering like an assessment that's $175 an hour in 6-minute increments, you know, how do you get people in if that's, like, I think it's a different approach than what we've been doing.
Well, so I can tell you when I first started, because I was on my own, this was just, again, kind of on a whim. Somebody said, how much do you charge? You know, I thought that I invented the profession. I didn't even know about the Aging Life Association at that time. I'm like, why isn't everybody doing this? Turns out they are. But you know, I started because I was trying to get my name out there, get the services out there. I knew what I was capable of, but how do you get your first client, you know, especially with a rate that seems really high. So I started with a low-cost assessment, and maybe in your case you're offering a no-cost assessment. But it was very, very detailed. That assessment that I provided came with, you know, it was probably 8 pages when it was done in terms of the things that I assessed and then the recommendations I provided. But how it hooked people into hiring my services is that, you know, you're giving them 12 or 14 recommendations because we're looking at all of these knowledge areas, right? We're looking at, you know, safety is not just home safety. It has to do with medication compliance and falls and wandering and driving and, you know, and that's just safety. And then we're also looking at nutrition and we're looking at behavioral health and we're looking at cognition. We've got all of these different boxes to tick, but implementing the interventions for those are usually overwhelming for families. Either they feel like they can't do it, or maybe they actually can't, or they don't have time, or they're in the workforce, and in order to do all of these things, they would have to take time off to do it. So where people hired me was to implement those kind of low cost, and you know, I started doing my comprehensive assessment for $300. I now charge $800. My competitors charge $1,500. But so, and that's in Northern Virginia. This DC area is, you know, we've got a high cost of living here. But people, what I'm saying is that people will pay for the expertise. They are hungry for the information. They get drowned in Google. It's information overload, and you don't even know what you can trust. They want local people, local experts, local referrals.
Do you have stats on how people are finding you? Is it like a Google search? Is it like word of mouth?
So yes, as I have grown, I've been good about keeping track of my KPIs and, you know, learning this business side. So they come, and it's changed over time how people find me. Now I get a lot of word of mouth. Now I'm taking care of this mom and dad, and then I got the in-laws, and then I got the, you know, 50-year-old with developmental disabilities all in the same family. So there's a lot of, you know, this kind of service, people tell their friends. So there's a lot of word of mouth. The Aging Life Care Association membership, one of the member benefits, and there's tons of business and marketing and promotion and templates for press releases and, you know, all kinds of business growing things that you get as a member. But you also get a zip code search. And so we pop up in that zip code search. People find us that way. I do have a social media presence, and I'm active personally on Facebook. So one of the things that I have done, and I mean, I've got 4 kids. I'm a nurse. I was a Girl Scout leader. I'm involved in my community. But And I don't know if you're on any of your community groups, all of the different neighborhood groups. Well, people ask questions. They say, my mom's in the hospital, we have to send her to rehab, where do we go? I answer the questions, I don't put out, sign up for my services, and for $175, I'll tell you the answer. I give them something. I answer the questions and to demonstrate my knowledge and my expertise. And very, very often, and it's usually not the person who asked the question, it's somebody else that looked at my response and said, she knows what she's talking about, and they reach out to me. So we get referrals that way, and then as we have kind of grown our referral network, I get referrals from home care companies who want to put home care in, but there's kind of a semi-boarding situation going on, and nobody wants to work in that home. Or maybe they need a live-in caregiver, but the guest room needs to be cleaned out, and the family can't get it together to do that. Or maybe, they're seeing things, assisted living. I get referrals from if they're having somebody who maybe has really challenging behaviors that are threatening their ability to stay, but when assisted living tells the family this is not sustainable, they think, oh, they're just trying to get more money out of us, If I go in and say, this is not safe for the people who work here, it has more credibility, it's the same message. But then, I'm also trying to get them connected with the right kind of medical care, supporting the staff with, care approaches, different things there. Estate attorneys who are, doing power of attorney documentation and hearing from families that they are overwhelmed and need help with other things. Nationally, estate attorneys, elder law attorneys are the largest referral source for care managers, those big numbers. It's not my largest referral source, but nationally, attorneys refer a lot of business to us. I got a referral from a financial planner right before I came on the top of you today. That's in my email. So, a lot of our community partners. I think that's it. So folks, I have, my contact information is there. I've got cards. I've got a handout from the Aging Life Care Association. And I also brought brochures in case you need inspiration for kind of how to market your services. This was done on Canva for super cheap. So anyway, might give you some ideas. Thank you.
We're moving on to a quick interlude before lunchtime. It's time for our group photo, our annual group photo. So we have a few minutes if you want to freshen up real quick, but please meet us in the atrium for that photo.
Okay, I'm there. Okay, I'm done. We get ahead for like yeah, I was like, well, I can't go back home.
your way to the atrium for the group photo.
No, I was in Aspect. It was good. I haven't been to
You're like, I better know this because I'm working on a project.
maybe, I don't know, but like.
That's the secret of consulting. You know something one day before your client does.
Already have that skill set, so then being able to build off of that.
Yeah, I'm definitely.
Filipino Advocates for Justice. So they're located in. Okay.
Thank you. Where are you from? We had our conference, was in Philly last November. We were at the I'll have to ask, I live here in Northern Virginia, but our current chapter president is out of Kenosha, so, yeah. I had a lot of fun. We had some after party, was at the bar that used to be.
If I can invite you to please go outside for the photo.
Wild.
Miss Heather, Mr. John, if I can invite you to join us in the atrium for the group photo. It's happening right now.
Sorry. Thank you.
We just want you in it.
Thank you. I'm so much. Thank you.
Don't worry, you're good.
You don't need?
Yeah.
it's more of my head than what I projected out, yeah.
It's like what Rachel was saying the other day about all of these scenarios that you're just judging on about like.
Thank you.
Nope, it's yours.
Just like that?
That's Sunday.
I know I got one. I didn't even do my own selfie. Look at that. Nobody likes looking at themselves and laughing at themselves. They're always the best
Same,
ones.
I'm the exact same.
Yeah. They're always the best ones. Best energy, best vibe. Sometimes it's a good scratching day. Yeah, I was like, go ahead, you got it. I had more on my face and my brain was like, that's okay. But you did good. Thanks. Yeah. Yes. My daughter says this stumps in a little bit, but he's gonna find that whole business. get soda right. He said, I said, never get some ice. I got a soda drink that you can try. Maybe left. Yeah, you are right. So, I was like, so let me just get some maybe that. Here's some. Yeah, right. Is that here? I think that's what's here.
Yeah, I think I told you. Yeah, I think I told you I was gonna help you find one. About what, Mom? Wow.
I have Hi, I have something to tell you. It's very important. I come from the future.
Come from the future. Say that. Okay. So, wedding. Is a request. So, well, the ceremony itself, top to bottom, yeah. And it's going to sort of like close or climax with like this, yeah, with like an exchange, like an energy transfer. What I mean, Maggie, is going to the opposite, gather around us, and forming like a literal physical web. They're like find the people who they've known the longest in the whole, including potentially us, gather around those people, and on the shoulder of the person who longest, so everybody is touched twice and touching twice. Okay? Potentially what's tricky is because if it's like a big mass, we're going to ask them to like introspect basically. One on a moment of self-love, another on a moment of like belief or faith in someone else, and third on a time in which they were elevated beyond themselves because of their connection. And want to give appropriate, not too long, not too short, question, enough time for people to like look into that space, which could be easy for some, hard for others, right?
Yes,
But like while they're standing, sort of huddled in that, touching and being touched. So, trying to like figure out how long is this too long? How much you need for people to go to that place and actually like, I don't even give a gift.
night. So, you know.
I think it's gonna be really fun.
It's hard to. I know, but I know respite, so then everyone's like, talk about respite, you know your stuff. You do, I know. You're not a co-op, like a basis.
Isn't it something that's just like where does money find
So from the very door,
Yeah.
A, and like, what do you think? Like,
I want more of you guys.
30 seconds.
Well, I'm strong enough.
How long do you have?
Yeah. But I'm not last year and.
And also to be clear, those who are audience. Yeah, most of the guests are not going to be of the community, right? Who's going to be let me see this one.
And we're working with Bates and Kelly Peterson next year. Oh, we're already working with, you probably already know this.
I'm with the Isaiah Group. Yeah, and so.
Sign a contract with you guys.
Yeah.
For them.
Yeah.
A little bit.
Yeah, I put some technological, individual, like,
And not taking that food right there.
That's why we're not going to have anybody here if that other second person is like far off. It's like, then make it. But if someone else is nearby, I can pull up the exact word. Not as It's only to help people feel comfortable in themselves. Yeah, they're not strangers. You know, they're happy. Yeah, so they're having this problem. Followed by
the day program is what is that?
She was on Equal Report. We're really all doing She's only going for 2 days a week. She's got another day she's with somebody else, and they go to the movies, or they go bowling, or they go swimming. And then one of the days she's with Anna, and Anna does all right.
Help you embrace it. I think I will. There's like after 45 minutes.
I'll actually. You are. Well, somebody Sandra. Exactly. So
We just have like, yeah, we like chosen because they really are. So it's like a different stage of life, different concept, side of things.
Also wants to so if you buy 6 or 8 people, the price per vehicle, right? It's a deal. We're going to be someone who goes around up. We are. There you go. We got this. Even you can sort of next year.
It's like sometimes you go to a conference. We're billing it for DHS. Yeah, we're like, what you're saying is the federal can tap into a program and
What are y'all gonna do
Well, I got the data salad last night.
unwind, de-stress,
right about you. She's all excited, and he's like, yes, and she's so excited, she goes, aware of your surroundings, be aware of it over and over. Not even what is the federal program?
Thank you.